Hi, this is Jim Welsh from macrotize.com. Thanks for tuning in. Health officials in the United States and around the world want to make sure that a second wave of infections from COVID-19 does not occur. Back in 1919, with the Spanish flu, there was a second wave, which actually caused more infections and more deaths, as the chart of Sydney, Australia illustrates. Many investors, I don't think, fully appreciate and understand the dynamics of COVID-19. Many believe that a peak in infections and deaths mean that the worst is over. On April 6th, the S&P 500 rallied 7% because of reports showing that Italy and Spain, as well as New York, were experiencing a decline in the number of infections. I think this misunderstanding will likely lead to another selling wave and a retest of the March 23rd low at 2192. To really put this in perspective, global planning is not possible, and as Dr. Fauci said, you don't make the timeline, the virus does. One of the important differences that I noted back in late January between COVID-19 and SARS and Ebola is that people were infected before they would actually show symptoms. And we can see the impact that that has had relative to SARS and Ebola with COVID-19. So let's take a look at herd immunity and what it means. COVID-19 has an R0 factor of 2.1, meaning that it is 20 times more infectious as flu, which has an RO factor of 0.1. The other disturbing factor is up to 25% or more of those infected are asymptomatic, so they can walk around for 5 days to 2 weeks infecting others. With a vaccine, you need about 40% of the population effectively to rely on herd immunity. But if you don't have a vaccine, you need 90 to 95% of the population to have acquired or been exposed to a virus to have an immunization that is natural. We are at least 1 year away for a vaccine for COVID-19. So we all have learned what we need to do in terms of our behavior. Sheltering in place, social distancing, wearing a mask in public, which has just started here in California, and I think will go across the nation. If you're symptomatic, isolate yourself, and then wash your hands often. But the science is the important thing that I think a lot of investors don't fully appreciate. We're going to have to test everyone, which means we got to make millions and millions of testing kits. If someone is positive, they get isolated. We have to prove with a second test that they are over the virus and healthy. So enormous amount of testing has to be done. Then a second test has to identify those who have had the virus and now have antibodies. And that is called convalescent plasma therapy. And the idea, and this has worked with other viruses, is to take COVID-19 antibodies and inject it into someone who is sick. Ideally, it will minimize the number of deaths, shorten the time they are sick. Key point, this has not yet been proven. Although it's worked with other viruses, there's no data that shows that it works for sure with COVID-19. We're at the testing stage. Once someone has had it and has developed immunity, they can go back to work. So the point here is that it's going to take time to test everybody, develop a CPT therapy, and I think what that means is President Trump will have to extend the shelter-in-place order beyond April 30th, and I think that's going to lead to another sell-off and a retest of the March 23rd low at 2192. Thanks for tuning in. May something good happen for you today.